You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, a new treatment option for people suffering with gum disease. According to my first guest, no more bleeding gums, bad breath, loose teeth, eliminating gum disease with the use of a laser. We're talking about laser dentistry today. With us, we have a board-certified periodontist, Dr. Joshua Mondlick. Dr. Mondlick, welcome to the program.
Thank you for having me, Randy.
Now, for people that don't know your practice as a periodontist, who's your typical patient?
Well, my typical patient is sent in by the general dentist for something that might be a small problem or a large problem, something that can't be handled in the general office anymore. So it might be a missing single tooth that we would replace with a single tooth implant. Randy, also we have patients who come in with gum recession. So they frequently will have a cold sensitivity on their teeth. It might be in the back, it might be in the front. A lot of patients who have gum recession in the front, they don't like the look of their smile. So to them, they'd like to improve upon it. And so we're able to do tremendous things in terms of taking gum tissue and replacing the missing tissue to give them back a lot greater ability to drink cold liquids and eat ice cream and to just enjoy foods the way they haven't been able to for years. Randy, a lot of people feel like they have short teeth, and so frequently we're able to use a laser to just remove the appropriate amount of gum tissue to showcase their full amount of tooth in their smile. And it's really remarkable. The changes are life-altering for patients, give them greater confidence. Just the difference between when patients come in with their smile to when they come in for their follow-up, the smile, it's like they're a different person. They're a different person, yeah. Also, general dentists will send in patients who have, really we put them into two categories. Some patients that might have all of their teeth that are needing full mouth extractions and moving towards implants to hold on to a set of teeth, or we have patients who come in who are already in dentures who have no teeth that are looking for implants to retain those dentures. Those are treatments that we're able to offer in our office. However, sometimes those patients who come in with their full mouth of teeth, we can actually save those teeth or save a vast majority of those teeth by using the laser.
You know, we were talking about in the green room that a general dentist might send the periodontist for extractions. And you say because of your laser, you're able to save teeth. That means teeth you would have extracted years ago, now you're able to save. Absolutely. Is that right?
Yes, yes. I mean, some of these teeth are moving around. They're extremely mobile, and they're loose, and there's bad breath coming from the gum tissue, and there's bleeding gums. And these are patients where their expectations are they're going to lose their teeth, but frequently they'll say, I really want to try to hold on to my teeth. What can we do about this? And for the vast majority of these patients, we're able to save a lot of teeth over the course of time with using this laser. And it's bringing back patients' ability to, bite into things comfortably and smile and have the confidence that their teeth aren't going to fall out at any given time. I mean, some of these people, Randy, have very loose teeth, and they are very uncomfortable with this.
Okay, good. Now we're talking about gum disease today and how you're taking care of it with a laser. At the top, we said no more bleeding gums, bad breath, loose teeth. So there's two ways, I guess, that periodontists across the country are treating gum disease. First off, what are the symptoms of gum disease, and what are the two methods?
So the symptoms are bleeding gums, bad breath, and loose teeth that are moving all around. Shifting teeth would be also an indication of what periodontal disease is as well, gum disease, periodontal disease. Patients who come in and they have loose teeth, essentially what's happened is they have a bacterial infection that's gotten into their gums, and it's beginning to erode the bone that supports the teeth. So the teeth begin to move and shift. And as well, you're starting to see bleeding coming from the gum tissue. And the third aspect is this bad odor that comes from this area due to the bacteria. So we're frequently able to use the laser to go around and decontaminate the bacteria in the area that surrounds the teeth, and we're eliminating the inflammation and all the bad gum tissue, and the gum tissue then has the opportunity of closing around the teeth and making those teeth tighter. So it really, the results are great, and we're finding that patients, they're coming in. I mean, I have patient after patient that I've done this procedure with, and they come in for even their 2 or 3 week follow-up, and they're telling me my teeth, they're not as loose as they used to be. And I'm more fascinated with well, what about the bleeding gums? Is that gone? Yeah, that's gone too. Is that right? But the teeth are not moving anymore. Yeah.
Now, I mean, when you're flossing, it's okay to bleed a little bit.
No. Not okay.
Really?
Yeah, not okay.
With a tiny bit of blood.
No, I mean, would you like to bleed if your hand was bleeding? You know, would you be tolerant of that bleeding day after day? I mean, no. If bleeding
that's a sign of infection.
Absolutely, yeah. Absolutely. Gum bleeding or bleeding from the gums is a sign of infection. It's a sign of a problem. The question is, you know, how extensive is that problem? But absolutely, that's something that we would really need to look after and take care of. It's not a good thing, and it's not a sign of health. So traditionally, these patients will come into our office, and I can tell right away when I walk into the exam room that they have extensive periodontal needs because I can smell it, Randy.
Oh, really? Okay.
Oh, yeah. And so after I finish my examination and we determine the extent of their problem, we have to actually cut open the gums to get access to where this diseased tissue is and where the bacterial
around
infection.
the tooth. So you're actually peeling the gums back.
We're peeling the gums back, and once we have the gums open, we're able to get great access to clean the roots and to get everything nice and clean, get rid of the pus, get rid of the infection, and then when we're finished, we're getting rid of the microscopic bugs, we're getting rid of all that stuff, and when we're finished, we have to put the gum tissue back, we have to put stitches, we have to sew up the gums, and then send the patient home with...
And that's the old way. You don't do it this way.
No, well, no.
Okay.
I mean, I did do it this way until I brought in the laser, but yeah, no, we used to do this all the time. It's being done in Arizona all the time, Randy.
So that's a common procedure?
Absolutely, yes. And there's
hundreds being done throughout the state a day?
At least, yes, at least. And the thing with it is that after these patients leave, they have a lot of soreness. It's uncomfortable because we've actually reflected and pulled back their gum tissue. So that takes time to heal. So the healing, it takes longer, and it's a little bit more uncomfortable for patients. We can medicate for it, but you know, I want to move the conversation and say that there's another way that we can do it, and it's a lot easier for patients, particularly in the way that they heal after the procedure. So that's with using the laser. So I'm able to use this laser to go around, and we use light energy. It's incredibly cool. And we use light energy, and we're inserting it into these deep areas that was where the bacteria is living. So with the laser, we're able to we're able to approach this bacterial infection in a very different way. Okay. So instead of cutting open the gum tissue, we're actually using the laser's light energy to remove the bacteria, to kill the bacteria in the area that's surrounding the teeth.
So how does the laser kill the bacteria? That's the part I'm not getting.
The laser actually is selective. It uses light energy to select these bacteria have light characteristics, and we're using
a color to them.
It's color, essentially a color, and the laser, and they're sensitive to certain colors, and so the laser, because it's very selective, it actually selects and it kills this bacteria. Also, it kills the inflammatory or the gum tissue that's really red and hot and juicy, and the stuff that's causing this pain and the bleeding. The laser does both things at the same time. It's really incredible. It's really incredible. Okay. And so afterwards, when the patients go home, they're not having the difficult healing like they did with the traditional surgery. Okay. They're waiting. I have patients who come in after the procedure 2, 3, and 4 weeks later, and
so you go around their mouth with a laser.
Yeah, they go home. There's no sewing of the gums. We didn't cut anything open, and they go home and they're waiting.
Waiting for what?
Waiting for pain to settle in, and they never get it. Okay. And it's incredible. We don't have to use the medications that we have to for sensitivity with the traditional surgery. We're able to just put patients on routine anti-inflammatories, a couple of days. They come in and they go, you know, everyone tells me when they come back in, it was no big deal. I mean, I'm befuddled every time someone says that to me, because it's incredible how amazing this laser is. So let me go back to that whole no pain. So we're putting patients on anti-inflammatories. So with them being covered with the standard ibuprofen and Advil or Tylenol, they're really not having any kind of significant discomfort that they tell me beyond 1 day. So from their perspective, based on how severe they knew their infection was, with them walking out and having very little discomfort, they're over the moon. Whatever they're experiencing, they've been telling me all along, is no big deal.
Now you say the bad breath could go away, like they come in with really bad breath and they leave and their breath is fresh.
Well, they don't leave with the fresh breath.
Like how soon does the breath get better?
Couple of days.
Is that right?
Days, yeah. So that's what they're telling me. I mean, I'm seeing these patients maybe a week to 10 days after we do the procedure for a follow-up, and when they come back in and I walk back into the room, I'm not smelling that same characteristic smell that is indicative of gum disease.
Okay, now, we've had a lot of discussions on the telephone about this topic, but back to the two different ways. So the one way is you've got this bacterial infection in your mouth. Mm-hmm. They stitch open the gums, peel them back to have access to the tooth so they could clean it, deep clean it, right?
Right.
I just want to make sure I have this correct. And then you have to sew it back up.
Yes.
And then they have the downtime. It's very sore, etc. So that's one way to do it. But it's microscopic bacteria.
Yes.
So you didn't get it all by cutting it out.
Correct. Not with the traditional method.
Whereas the laser you use actually kills the bacterial infection.
Correct. Yes. It actually kills. Yes.
Well, logically, it sounds like, well, why isn't everybody doing it this way?
Well, I think that on some levels, people are comfortable, periodontists are comfortable in doing the traditional methods, and that's what everyone knows, and that's what the public is aware of. And really, this is a newer technology that actually recently was FDA cleared for, they call it true regeneration or bone regeneration around the teeth. And all of the key opinion leaders in perio and periodontics are changing to this because as the literature continues to come out, they're finding that this is a much less invasive way to treat the same disease that we've been trying to treat for generations.
So people lose their teeth. That means, and I think I told you this, I Googled it, like 20 million people in the US have an upper lower denture.
Yes.
And you say, and I don't want to put words in your mouth, but I'm paraphrasing slightly, that it really, most of the people that lose their teeth is because of gum disease.
Yes.
Because of this infection.
Correct. Right.
Now,
right.
do you believe that if you could have got these 20 million people early, like in their early 20s, 30s, whatever, go around the mouth laser, you could have stopped and eliminated the tooth loss?
Yes. I mean, for the vast majority of these patients, if they had early intervention, we would definitely be able to save a vast majority. Now, I won't be able to say, all the teeth, but a vast majority of the teeth we'd be able to save, and we'd be able to prevent them from, being at home and not being able to do the things that they want to do as far as eating and chewing and going out and having the self-confidence of having a really great, healthy mouth. When this disease, when the periodontal disease sets in, and you have a lot of discomfort coming from your mouth, after a while you accommodate for it. So then you don't even really believe that you have it, and you're altering your behaviors as far as what you're doing, what you're eating. Well, I mean, you can't, if you have loose teeth, Randy, you're not going to be able to bite into an apple or a juicy burger without...
Or a sandwich or whatever.
Without feeling like your teeth are going to move or maybe even fall out. That's a huge thing for someone to be able to have the confidence that they can go to a restaurant and eat casually and amongst friends and not have any tooth problems or discomfort or wincing with pain when you bite into something or biting on the side of your mouth. Absolutely. Is
this the future of dentistry, like whether it's 50 years or 20 years, that you go to your hygienist and maybe they go around the mouth with like a lower level laser?
Absolutely.
To kill the bad bugs?
I think they were heading there. Absolutely. Yes. I mean, in my office right now, I'm not seeing those patients come in early enough. So the patients that I'm utilizing the laser on, we're not seeing these people as early as I'd like to be able to really prevent significant bone loss from occurring around their teeth.
Interesting. Now, for people just tuning in, we're talking about laser dentistry, specifically wiping out gum disease, bleeding gums, bad breath, loose teeth. There's two ways to do it: surgically removing it or killing the bacterial infection with a laser.
Absolutely.
And so, young guy, when you talk to your buddies, your periodontist friends,
sure,
that aren't using the laser, what do you tell them?
I tell them that they really need to get on board with this, and they still think that some of them still think that it's voodoo, and that's okay. I've seen the results, and I know what can become of this.
Are there published papers that show that this works?
Absolutely. The literature continues to come out, and not only are we able to use this laser around teeth, we're able to use it around implants as well now. And so that literature is coming out slowly but surely. It's showing that we're able to create the same decontaminated, no bacteria surrounding the implants that we're able to do around teeth.
And they get beautiful, fresh breath.
Absolutely.
Nice teeth.
No more bleeding.
I told you this on the phone. My cousin, he had 4 teeth that need to be extracted from a periodontist in Los Angeles. He calls me because he knows of the show, and he says, maybe you get me a discount. I said, you should see my laser dentist in San Diego. So he goes here. She goes around the mouth with a laser, no extractions. Now he's in Invisalign, and he's got this great teeth. You say that happens all the time. People that were told you're going to lose teeth, the laser saves their teeth.
Right. And then all of a sudden they start doing braces because they want to reposition the teeth that have shifted and they're now tight in their mouth. So Randy, I had a patient come in the other day. I mean, extremely loose teeth, horrible bad breath, and also out of control diabetes.
Okay.
And a lot of medications, and he came in, he was not happy. He had neglected going to the dentist for decades. He knew he had a problem, but he didn't want to know how bad it was, and so he was, avoiding even acknowledging what the situation was. And he said, look, I think that a lot of my teeth are probably going to be, needing to be removed, but I'd like to try to hold on to them.
Okay.
And he said, and what can we do about it? And I said, well, actually, we can do a lot of things about it. We can use the laser. And I said, and a lot of the mildly loose teeth are going to tighten up right away. And then some of the more loose teeth, they will tighten up over time. It might take up to a year for them to tighten up. And then you're going to be able to have your ability of biting into things, chewing, whatnot, back, smiling. So I saw him the other day, it was about 4 months. I'm going to try to explain to you the difference of when I met this guy originally to when he came in 4 months later. Beaming, almost like a different man.
Okay.
And just elated with kept telling me, you don't understand. That's what he kept saying to me. You don't understand. I'm able to chew into things. My teeth aren't loose. I never thought I would feel this way without going towards dentures. I mean,
now I'm not quite getting this loose teeth thing. So
sure.
Okay, so the tooth, and you got gum disease.
Right.
So the gums move away from the tooth, and the bone underneath is kind of being eaten away.
Yeah, it
by the
retreats.
infection.
Yes.
And that's why it's loose.
Yes.
So when you kill that infection, the gums hold the tooth. Bone gets stimulated.
So,
is that kind of how it works?
Absolutely. So imagine the tooth in bone as an umbrella in sand. So if you don't push the umbrella into sand very much, the umbrella is going to move all around. But the more umbrella you put into sand, the less it's going to move. The sand is just like the bone. We want to try to have as much bone around teeth as we can, and we want to have those gums to be nice and healthy and tight, and that also contributes tremendously to the stability and to the rigidity of teeth. And the more rigid your teeth, the more likely you are to eat whatever you want and have the confidence to bite into things. So every day, hundreds of patients are going through with this periodontal surgery in Arizona. And for those people who have gotten ready to do the surgery, they should look at getting a second opinion for using the laser. Because oftentimes these surgeries, the traditional surgeries, are only being done in a certain section, maybe half the mouth or a quadrant of the mouth. And it's very challenging for those patients to come back in when they know what they've gone through from the standpoint of the healing process.
So the old way where you cut the gums and peel it back and clean the tooth, because we've talked, you were only able to do like one side of the mouth.
Right.
And then they go home, they heal up, and then they come back to do the other side of the mouth. But you say they don't want to come back.
Right, good luck getting them back in.
Really?
It's a lot easier to go and do with this laser and the LANAP protocol to be able to treat, you can treat the whole mouth or you can treat half mouth at the same time. And the discomfort is much less.
So this is really changing dentistry?
It's changing periodontics in a very big way.
There's not even a use for you guys anymore with this laser.
There will definitely be a use for us. There's plenty of disease out there, and there's plenty of patients who are going to need our help with this.
Okay, now there's a slide you brought,
yes,
which shows what the bad bugs in the mouth look like.
Right.
Okay, let's go to that clip and tell me what we're looking at here.
So on the slide, you can see that there's a lot of movement with a lot of bacteria and bad bugs, and this is what you don't want in your gums. You don't want these bacteria to be harboring down there. So again, back to the possible treatments. You can either cut this out with a blade, or you can eradicate it with the laser. You can just get rid of it with laser light energy.
So once you go around with the laser, you can actually show an after slide.
Yes, and
those bugs are dead.
There's no more movement on that. The bugs are dead, and everything is still, and that's what you want. So Randy, we're also seeing, as far as the difference with the bacteria from the different types of treatment, we can either do the traditional where the bugs will disappear for a period of time, but studies have now shown that often the bacteria will come back again, whereas we're seeing that not happening as quickly with the laser. That's right, that's right.
So the holistic crowd, like the Whole Foods crowd.
Sure.
They don't want maybe antibiotics, they don't want that kind of stuff.
Right.
This is big for them.
Huge for them, Randy. I mean,
because it's like a natural approach.
It's a natural approach. We're not having to use antibiotics afterwards, and we're also not having to use and utilize the amount of pain medications after the procedure done with the laser versus the traditional surgery.
So if you're worried about losing your teeth, get this done.
Absolutely, absolutely.
Now what about insurance? We should mention, does insurance cover the surgical procedure? Does it cover the same amount if you're going to use the laser?
It really makes no difference. It really makes no difference. It's essentially, in dentistry, it's all based on the procedure that you're doing. And so we're doing the same procedure, but we're utilizing a different method of doing the procedure.
Now we should mention Medicare, Medicaid doesn't cover this. procedure. What about great dental insurance? Does it cover a portion of the procedure?
Absolutely, it does. I mean, there's hundreds of different types of policies out there, but yes, in general,
Are you hooked up with a lot of the insurance?
Yes.
Okay.
Yeah. So it's a wonderful procedure for patients who have these types of problems. It's funny, I also have a lot of patients who come into my office routinely for routine cleanings. And some of them have problems, and they know they have these problems, but whenever I've been trying to have them do a surgical procedure to correct them, they've been dodging it because of what they've heard about from the traditional methods of doing these gum surgeries. And so I also have patients that now that I'm able to offer a different modality, they've actually the laser, going with the laser, they've elected to do the procedure, and afterwards they're telling me that, from the minute I walked out of here and from the hours after the procedure with the laser, I noticed that the healing was just different. It was good. I could feel something going on. And I've seen these patients now 7, 8, 9 months later on, and it's remarkable. We're seeing bone regeneration next to teeth. Patients are really not having much discomfort associated with it, and they don't have to alter their eating, or they don't have to change what they're doing at home. I mean, a lot of times we want them to enhance what they're doing from keeping their teeth clean from a home care perspective, as far as brushing and flossing and using a water pick. But in general, they don't have to make a lot of changes as far as what they're doing.
Now, on your website, there's a button. It says "No cut, no sew."
Right.
That's like almost a slogan you guys have for this laser.
Yes.
What does that mean?
So it's really just saying that, of the 2 different ways to treat periodontal disease and bleeding gums and bone loss and loose teeth and a bacterial infection, we can do the traditional method, which cuts and sews, versus using the laser, which just goes around the teeth with light energy, killing bacteria, getting rid of pus, getting rid of the bad gum tissue, with no cutting and no sewing. We're not putting stitches in. You don't have to come back to get stitches removed. It's awesome.
Have you had it done?
On myself? No, no, not yet.
Any family members?
No, not yet. Thankfully, we've been able to keep everyone healthy, and so. But if the time comes, this would be my procedure of choice.
So if you had a family member with bleeding gums, the big puffy red gums, loose teeth, distant family member or not, like you would no way do the surgery way.
Even a distant family member, yes, absolutely.
So you would always do the laser?
I think it's an incredible first-line treatment for patients. And so this is the easiest way to see if you can get great results, and often we are. And if we're not getting great results, we have other ways of going about it, but this would be the thing that I would start with.
And the teeth end up looking better, feeling better?
Absolutely.
And we're short on time, but people with bad teeth, like in the movies, you want to make somebody look poor, you give them bad teeth. You want to make somebody, the villain always has great teeth.
Right.
Or remove one of their teeth to make them look not so smart.
Sure.
So those kind of people, if you can get to them first somehow.
They're candidates for the laser. Yeah, they're candidates for this type of procedure, and they can get some great results. And then once they get great results, they can go on and do incredible amounts of other aspects of dentistry to enhance their smile and to enhance their confidence. So I had another patient who was sent in to me by a general dentist, and the general dentist felt like a lot of these teeth would need to be removed, and he wanted as a last-ditch effort to see if we could do anything with it. And this patient was really beside himself. He didn't want to lose any teeth if possible. And I said to him, I think we can utilize this laser and we'll get some results. Is it going to be good enough to hold on to the teeth? We will see, because they were significantly affected. And so I too was curious. I thought, let's give this a whirl, because I know it works, but how much is it going to work? And so I go around the mouth with a laser. We do the whole mouth, and even though it's only affecting a handful of teeth, we do the whole mouth. And 8 months later, incredible results. We're seeing greater bone surrounding those teeth. They firmed up. They're still a little bit mobile, but they're not going to be ones that are going to be slated for removal anymore. And this guy's going to hold on to his teeth. He couldn't be more over the moon, Randy. I mean, to be able to hold on to your teeth, they're your own. It's what was given to you. You've got to work hard to try to keep those teeth in the mouth.
What about health? Do you have to be somewhat pretty healthy to get this done?
No, I mean, I have a patient that we've treated who is on blood thinners, and so she was very concerned about having traditional gum surgery because of the aspect of opening the gums and creating bleeding, whereas this procedure is entirely different. It doesn't do that, and it's not affected by patients who are on blood thinners. And we do this procedure with patients with uncontrolled diabetes. And diabetes is directly connected to bone loss and periodontal disease.
Now, with any other infection, so you're calling it a bacterial infection in the mouth. So
Yes.
I know when you have the flu or you have an infection, you have no energy. Do you find that, because I've talked to other periodontists that say when they clean up this bacterial infection in the mouth, these people report to have more energy. They feel better. Are you experience the same kind of thing?
Absolutely. I don't know whether or not they feel better because just they're not having the debilitating discomfort
They
from
have a
their
clean
mouth.
mouth again.
Right. Or they're just reinvigorated with the fact that we did a procedure with a laser. And it's cool, current and future technology that we're using here.
Because there is an immune response to this. So obviously it's one less thing for the body to have to worry about.
Yes. Yeah.
So it's a healthier way. So can healthy people get this done?
Absolutely.
To just go around and kind of kill the bad bugs?
Sure. If they have a need for it, absolutely. Yes. Yes, we can definitely. I mean, if they've got slightly bleeding gums, I'd love to see them earlier on before things, take hold and they get pus coming out of their gums. I mean, we want to catch people early with this.
So is that what, because by the time they get to you, we laughed a little bit of this at the break, but by the time they get to the periodontist, they're in bad shape.
Right.
And you want to get these people early on when they're just getting the puffy red gums or loose teeth or
Yes.
bleeding gums, because then it's easy for you.
Much easier.
A lot less expensive.
And it's easier for the patient as well. It's just in general, it's going to make it easier. It's brief. There's not as much treatment course for patients. Absolutely.
And they don't have to switch dentists. So you could have your own general dentist that you've been going to your whole life, go to you for the laser, and then they maintain them afterwards.
Correct.
Is that right? Is
yes,
that how it
absolutely.
works?
I work with some of the best general dentists in the valley.
Okay, good. Final message. Somebody watching this, they have the bleeding gums, bad breath, loose teeth. They've been told they need extractions. They've never even heard of this laser, maybe. Or they've heard what you have to say and they're still skeptical. What do you say to them?
This laser is an incredible treatment option for patients. It can change people's lives and perspectives with respect to the way that their mouth is feeling. So if they're even thinking about going to see someone for this, they want to make sure that they get this as an option.
Okay.
And I certainly would be happy to see them.
Do they need a referral to see you?
Absolutely not.
So they can go directly to you?
They can come directly to me.
Now, if they don't have a general dentist, you'll hook them up with one?
Absolutely. Yep.
Okay.
But once we've gotten everything under control.
All right.
Sure.
Well, thank you for coming to the show. Good stuff.
Thank you. Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.